An evolving enemy is the worst kind. Tried and tested methods may not work in their case. The Wuhan virus is one such evolving enemy. It has mutated thousands of times. Some of these mutations are more dangerous. They're difficult to trace. So what should we do? We must keep updating ourselves to tackle it. And mutations are proving to be the biggest challenge at the moment. They have been reported in the UK, South Africa, Brazil, the US, even in India. Earlier this year, India reported a case of double mutation. So why are these mutations, these variants important? Because they have supercharged the pandemic. In Brazil, the P1 variant is driving the surge in cases. In India, some experts say mutations are behind the massive second wave. So tracking these changes is very important. Remember the thumb rule of 2020, trace, test, quarantine. But tracing mutants is hard work. Your normal RT-PCR test is not working on them. In some cases, the mutants are escaping the test. So here's what happens. You get a test done and your result is negative, but you're actually infected with the virus. And you'll probably discover it when your condition is much worse. It's a very scary scenario. The US Food and Drug Administration has warned of this. Genetic variants could possibly mislead the RT-PCR test, your regular virus test. It's happening in India too and elsewhere in South Asia. So far, the RT-PCR was your best bet to detect the presence of a virus. Not anymore, it seems. The mutations pose a new challenge. So what is the workaround? Doctors will have to bank on their diagnostic chops. There are some classic COVID symptoms. The lungs, for example, they appear glassy in a CT scan. But not everyone should get a CT scan done, and even a CT scan can sometimes mislead. The foolproof method, we are told, is genome testing. What's that? It is finding the genetic code of the mutant. Unless we know this code, we will not be able to recognize the mutant, and so a test is not going to be able to detect it. So we must know what this mutant looks like for a test to discover it, to find it. We're basically operating in the dark right now. Going forward, genome sequencing must be our eyes and ears. Otherwise, even vaccines may not help. And I hate saying this because we spent most of last year praying for a vaccine. And as it turns out, the virus has a few tricks left. So we will have to up our game. The new variants are spreading faster. Are they also killing more people? Let's look at the numbers. This time last year versus right now. And now look at the trend. The daily caseload, this is what the last 5 days looked like. More than 746,000 cases were reported last Thursday, but by Monday the numbers plateaued. There were 588,000 cases reported globally on Monday. What about daily deaths? A similar picture. Last Thursday was a peak, more than 13,000 deaths. On Monday, this came down to 8,800. Now, this sample is too small to draw trends, but projections have been made for as far as the 1st of August. This is one such model made by the Institute for Health Metrics and Evaluation. What does it say? At the current rate of vaccination and mutation, we could be looking at more than 4,730,000 deaths. That's if the current trends hold. But if things get worse, in a worst-case scenario, global deaths could cross the 5 million mark. It's a nightmare scenario. But if everyone wears a mask and social distancing is strictly imposed, we can still save lives. A best-case scenario, unfortunately, looks like this. More than 4 million deaths. None of these scenarios are ideal. But that's where we're heading. Africa and Latin America are struggling with vaccination. Jabs are running out. Mutants are running riot. There is just one saving grace. Last year, the virus came out of nowhere. Most countries did not have the infrastructure to handle the cases, so serious infections inevitably led to death. In 2021, that should not be the case. We have added millions of hospital beds and thousands of intensive care units, so even patients with the mutant strain are surviving. The trend of 2021 is higher caseloads but fewer deaths. Remember the basic rules. They remain the same. Masks, social distancing, and sanitizing. Mutant or not, the sanitizer will get it. And vaccinate. Vaccinate like there's no tomorrow. Governments must pump more money into vaccine making, dispel all notions of vaccine hesitancy, and make herd immunity their #1 priority. The Wuhan virus is like a maths problem, a problem whose variables keep changing. WION is now available in your country. Download the app now and get all the news on the move.